President Fisher mentioned the importance to the Fed of healthy families and healthy breadwinners, and so this next panel continues on that theme, dealing with healthy communities and healthy gardens. What I'd like to do is introduce to you first Elizabeth Sobel-Blum, who's the Community Development Research Associate with the Federal Reserve Bank at Dallas. On this panel, we'll also have Dr. Heather Kitzman-Ulrich from the University of North Texas Health Science Center, and Salyer-Caldwell, Director of Tarrant County Health Department, and Katey Rudd with the Community Garden Coordinator Nutrition Department with the Tarrant Area Food Bank.
Hello, everyone. My name is Elizabeth Sobel-Blum. Can everybody hear me? Yes? I'm with the Federal Reserve Bank of Dallas. At the Federal Reserve Bank of Dallas, in the Community Development Office, our role is to support the economic growth perspectives of the Federal Reserve System by promoting community and economic development and fair and impartial access to credit. We do so by facilitating partnerships, coalition building, training, conducting a lot of research and publications. One of the publications that we have is Banking and Community Perspectives. We write several of them per year. I have brought some of them on and put them on the resource table to my left, your right. One of the ones that I most recently wrote was Building Healthier Communities from the Ground Up. This covers the topic of healthy communities, which I will be talking about today. When I'm saying healthy communities, it's about the intersection of community development and health. So when we say healthy communities, what exactly does that mean? When I say community development, the intersection of community development and health, community development, I'm referring to community development and economic development. When I'm saying health, I'm referring to health care and public health. So there are four distinct industries that are involved in healthy communities. But the idea of healthy communities is working together, these four industries, to leverage each other's expertise, resources, assets, etc., in order to be more effective in addressing health disparities and creating opportunities for healthier communities. And we get a lot of questions about why is the Dallas Fed interested in healthy communities? It's a great question. In general, wealthier people are healthier, and healthier people are more economically productive. Let me repeat that. Wealthier people are healthier, and healthier people are more economically productive. So therefore, it's in the interest of our country and our economy to promote healthier communities. Now, we know that individuals that community developers reach are the same individuals who face major health disparities. That's because where we live, learn, work, play, and pray affects about 70% of our health status. Another way to say this is that there are social determinants of health. And these social determinants of health, where we live, learn, work, play, and pray, greatly affects our health. If we look at what drives health status and healthcare costs, it's mostly in environment and behavior. It's about 70%, like I just said. So when we talk about bending the cost curve in terms of addressing how do we make sure everybody has access to quality health care, we need to include the conversation also about preventive care and also about living in healthy communities so people have opportunities to live healthier and more productive lives. When we talk about social determinants of health, one of the key predictors is socioeconomic status. It is measured by income, education, and occupation. And it's one of the most powerful predictors of health. It's more powerful than genetics, exposure to carcinogens, and even smoking. Neighborhood socioeconomic status affects our health. Now we know that when we look at health disparities, minorities get sicker, younger, have severe illnesses, and die sooner than whites. When you ask why, if you look at income inequalities, asset inequalities, you look at, for example, poverty rates, unemployment, underemployment, income inequality, et cetera, that's a great, it explains why you see such a huge gap. The Robert Wood Johnson Foundation is one of the premier foundations that works around the topic of public health and healthcare in terms of promoting healthier communities. And they established a commission to build a healthier America. And what they did is say, okay, this is what defines an unhealthy community, and this is what you need to form a healthier community. And so if you look at these charts, it's actually, they have a long report, but these are just examples of what they're saying. They're saying if you have streets and sidewalks that are in disrepair, you're more likely to have an unhealthy community. If you have no health care centers, a lack of public transportation, no parks or areas for physical activity, limited affordable housing, etc., those are indicators that it's a relatively unhealthy community. I wanted to point out the last box. It says convenience and liquor stores, cigarettes, liquor, billboards, and no grocery store. This is where our panel today will be talking about community gardens. It's supposed to address the specific issue of lack of access to healthy, affordable foods. Now, when we talk about access to healthy food, people always ask the question, well, is it by choice? Are people choosing to eat healthy food? Or is it about access? Are they unable to access it even if they want to eat healthy foods? And what we know is that low-income neighborhoods have 1/3 fewer grocery stores than higher-income neighborhoods. Corner stores and gas stations typically charge 1.5 times the amount for the exact same product than higher-income neighborhoods. Than grocery stores. Not having a car or adequate public transportation can reduce access to affordable, healthy food. And less expensive foods are often high in calories and fat. Now, when we're talking today about community gardens, I want you to keep in mind about food deserts. Food deserts are low-income areas that have limited access to supermarkets or large grocery stores. And this is important because usually it's these entities, supermarkets and large grocery stores, that do provide fresh, healthy foods. If you look at the USDA's website, they have a food desert locator. It's at ers.usda.gov. And what they do is if you actually put in your zip code, you can see where food deserts are across the U.S. There are an estimated 6,500 census tracts that have a food desert in the United States. When we say census tract, in general, it's anywhere from 1,000 to 8,000 people. Usually the median of that is about 4,000 people who live in a cluster of neighborhoods. And 75% of food deserts in the United States are in the urban areas. That affects 13.5 million individuals. So our role at the Dallas Fed in the Community Development Department is to play a convener role. We are convening the community development and health sectors to continue this conversation so we can move it forward. On September 28th in Houston with the Robert Wood Johnson Foundation, we hosted an event called Healthy Communities, the intersection of community development and health. And the idea was we brought leaders from the public, private, nonprofit sectors to talk about what are these social determinants of health. What collaborations have been successful, what haven't, and how do we move this conversation forward? And the response we got was tremendous. We packed the house. We broadcast our event live over the internet. 250 people watched it. 50 people were tweeting about our event. And what we were really excited about is that 80,000 followers on Twitter received information about our event. So clearly this is showing that there's an emerging movement and interest in healthy communities and how to push this movement forward. And so we would like to continue this conversation by playing the convener role. I'd like to see a show of hands of everybody in this audience. We're trying to get a sense of who's interested in some of the topics that were most popular for the participants at our conference. So please raise your hand if you would like to learn more about economic perspectives on health. It's a good portion of the audience. How about health impact assessments? A few. And asset building initiatives. A couple. Asset building initiatives. Okay. What we're doing, after this event, if you're interested in being part of this conversation in terms of moving this conversation forward, please give me your business card. I'll sign you up on our mailing list. And also what I did is on the resource table, I printed out a form where if you want to fill out your name, contact information, and the areas of interest you're most interested in talking more about, we'll make sure that you are included in the conversation. So thanks very much, and I look forward to a productive conversation.
Good morning. I'm Ann Salyer-Caldwell. I'm one of the associate directors at Tarrant County Public Health, and I'm happy to have the opportunity to come here today and to have people from different areas actually voice their concerns about health and the fact that health is integrated into all of our other concerns. So it's a great opportunity for me. I do want to say, Councilman Scarth brought it up, and so did Commissioner Brooks about our obesity meeting yesterday. And I'd like to point out we did invite you for lunch, but it was a healthy lunch. Because we know that's the secret to getting people to meetings. But also, this was a second round of meetings, and the goal is actually to have people be involved at the community level around making policy. And I'll give an example of a few things that we've done here just in like Tarrant County Public Health, because you can make policy for your church, dinners. You can make policy in the school. You can make policy in your workplace. And for example, at our health department, we sort of have a policy already developed so that if people are going to have a public health sponsored event, then the foods that need to be offered need to be a healthy choice. And that was a real change for people in Texas, because if you get more than 10 people together in Texas, they expect brisket and beans and potato salad. And so a lot of people called me the food Nazi there for a little while, but we just said all we need is a healthy choice. So if you want to have your brisket, that's fine, but let's have the healthy choice there too, because not everyone, is eating with the same background, so to speak. They're more interested in trying to take care of themselves, or they've got certain health issues they're trying to address. So just wanted to take a moment to talk about that. At Tarrant County Public Health, one of the big things that we do is collect a lot of data. And some of you all may have seen this before. We do a behavioral risk factor survey actually every 5 years, where we random digit dial a certain portion of Tarrant County to have people self-report their health behaviors and their health status. And this map up here is an example. And I'd like to, just for point of reference, I probably don't need the microphone, but point of reference, you can see this is zip codes here. So we're going down 30 right about here, and then we've got 35. So the darker the color on the map, the higher incident of whatever the risk is that we've got at the top of the map. In this case, it's overweight and obesity. So you can see it's not just in one area of the county. We have issues with obesity all through Tarrant County. 76105, unfortunately, though, tends to lead the parade on a lot of these risks. Okay, so obesity is one of the things, of course, that I just mentioned, and also physical activity. When we called people, we said, how much physical activity do you get each week? And you can see the areas, once again, the darker areas where people are getting less than the recommended requirement for physical activity, which was the 30 minutes 5 times a week. Okay? The next one, and these are all on our Tarrant County Public Health website if you want to check into it a little further. This is the incidence of diabetes, and we've got a couple really dark area, that's the 76109, or excuse me, 76102 area right there, and then some of the other areas that have a higher incidence of diabetes. But of course, whether we're talking about diabetes or heart disease or whatever, we know obesity and lack of physical activity have a lot to do with that. High blood pressure incidence, this gives you a picture of Tarrant County as far, high blood cholesterol rather. Now these are people, once again, who have been told that they have a high blood cholesterol, okay? And then high blood pressure, even more common. People get screened for that a little bit more often, I think, than they do for high cholesterol. And then the reason we're here to talk today, which fruits and vegetables have a lot to do with help us maintain a healthy weight. And you can see here we ask people, do you have 5 or more servings of fruits and vegetables every day? And they're only the lighter color areas, which there's not a whole lot of them, met that requirement. So We know that access to healthy foods that we've been talking about earlier is key to this. And so the community gardens that we're going to talk about today kind of gives us an opportunity to not only get some fresh fruits and vegetables in an area, but also build community. And the gentleman who made the comment about civics earlier, the community involvement around these gardens has been awesome. There's a lot of enthusiasm, but we've learned some lessons along the way. And I'll say that this all got started because we received an obesity prevention grant from the Texas Department of State Health Services, but it actually came from CDC. And we had like 3 choices of things we would work on as far as obesity prevention is concerned. And we were excited about working with increasing fruit and vegetable activity because we've had an interest in expanding farmers markets throughout Tarrant County. Because that's one more example of a way you can address an issue in a food desert is to have a farmer's market. So we started a campaign, and we actually have some bookmarks over on the table, but you can find it at Tarrant County Public Health as well. Our campaign is called Live a More Colorful Life because it's all around trying to increase the amount of fruits and vegetables people take in every day. And we have about 4 points that we follow with our campaign so far. The first is, of course, that we do need to provide nutrition education. And what we find is that not only is there a lack of healthy food, but there's a lack of knowledge about how to prepare food and how to put meals together and things like that. And so what we've tried to do with our website, the liveamorecolorfullife.org, is to feature certain fruits and vegetables each month with some simple, healthy recipes. And so no fried zucchinis on there or anything like that. And what we're trying to do is to give people some framework, not only with, you buy a fruit or a vegetable, and then I'm not real comfortable with how to fix it, so I leave it in my refrigerator, and the next time I see it, it's molded. I didn't even use it. So we find that a lot of people need some guidance on food preparation. So that's what we're doing at our website, and then also in classes that we do throughout the county. The second prong was to help increase the availability of fruits and vegetables through the farmers markets. We've talked about food deserts today. We know that we're in one right now. But we actually were able to start 4 different farmers markets here in Tarrant County. Many of you might be familiar with the one that's been long-standing out in West Fort Worth called Cowtown Farmers Market. We worked with those farmers to actually start 4 additional markets. One was in a major food desert, which is Richland Hills. Richland Hills has 8,000 people and no grocery store. So we started the first farmers market over there, and the farmers couldn't even pull their produce off the truck because people were standing at the truck buying the produce, because some of them had been driving, to other places to try to find a farmers market. We then went to the city of Pantego because they had a park there. They wanted to increase their use of the park, and they wanted to have an opportunity for more produce over in that area as well. That was very successful. And then we were able to start the farmers market at Tarrant County Public Health, which is at the corner of Rosedale and Main. So the people in this area, that's one of the closer markets, and we were able this year to start one at the Resource Connection. So those four markets have been very successful. It's been a real challenge this year because just like your yard didn't get any rain, nor did the farmers. So they struggled to keep the markets going. And we're hoping as the years go on, not only do the farmers have better production, but that the individuals and the communities have better production in their community gardens. And so what we said was in the next prong of our program is we'd like to actually start some community gardens. Well, we had good intentions, and we had some money to help people buy shovels and dirt and things like that, and that's all really good. And so we started 4 gardens, and 2 were school-based. One is at actually the YMCA on Miller Street, and then we had another garden that was more community-based. Well, what ended up happening is we had some passionate people that wanted to help work with us on those gardens. And then it's not good, as you've probably experienced, when the one passionate person moves away or gets ill or something like that. So we wanted to make our markets more, our opportunities for the community gardens more successful, and we were able to start a partnership with the food bank. And Katey will be talking more specifically about what she does. But the neat thing is we're able to extend our access to healthy fruits and vegetables through working now not just with the little grant we got, but also working with the expertise of the food bank. Because, you know, people who get foods from the food bank, the money that gets donated goes further for cans and bags and boxes. Most people don't get food assistance that's fresh produce. So what we wanted to do was actually increase the number of gardens, build the community, and at the same time glean off the top, that harvest, a little bit of food for the food bank as well. So Katey has been a key factor in this because she helps with the garden design and helps with the leadership training, because we know we don't just need one passionate person for a garden. We need a large number of passionate people, and that's where I'll turn things over to Katey right now so she can tell you our next steps that we've done with the community gardens.
I'm Katey Rudd, and I'm the community garden coordinator at the food bank. And it's been wonderful partnering with Ann in public health and just hearing everyone talk about how key collaboration is. That really is such a picture of what collaborating with other entities in your community really can do. We had a community garden program at the food bank. It started last August. And really, they hired me, but I didn't have any funding. And so for about 4 months, I just educated and went into schools and was trying to pull together how maybe I could write some grants or get some money. And I was able to meet Ann, and that just expedited and multiplied what we've been able to do in the past year. And wait, let me figure out how to work this. So just a brief background on the food bank. We're the largest hunger relief agency in the southwest part of DFW, have about 350 food pantries that we funnel food donations and food that we're able to purchase through financial donations into those community food pantries. We have quite a few in Southeast Fort Worth and East Fort Worth. And the vision of the food bank is creating communities where no one has to go hungry. And so basically that looks like capacity building, like putting more local food sources into those communities that don't have a grocery store or don't have access to those real foods. And maybe they have convenience stores like we were talking about earlier, but they don't have fresh food sources. So that's historically been our primary program for hunger relief, but about a decade ago, the food bank was just looking at their mission, their vision, looking at the communities and what they needed and realizing, okay, hunger and food insecurity really, it's a multifaceted problem. And so what other ways can we diversify our efforts to create more local food sources? So they did things like food stamps and backpacks for kids who are going home hungry over the weekend. And community gardens is one that they decided to add last year, which I'm very excited about. These are the 11 that we've been able to put in. And really, it's been a benefit to us because, as Ann mentioned, the majority of what we do get coming through the food bank is non-perishable items or frozen items. But fresh items, even if we get them donated, a lot of times by the time we get them in and then can transport them out to agencies, they're already going bad. And so we've spoken a little bit to that cycle of food access, food insecurity, and the associated health risks that come with eating foods like fast and convenience foods. And even a lot of non-perishable items aren't necessarily very high in nutritional quality, and often they're the very foods that create some of those chronic diseases that you see in low-income populations. So trying to look at it as a food bank at the amount of people that are accessing our pantries, which has gone up by 50% in the past 2 years and is going to increase. So with that many people it's about 1 in 6 in Texas are food insecure. I think that's the latest statistic on that. And many of them are accessing our pantries. So we really want to be able to provide them more fresh items if they're going to be supplementing their diet with it than just maybe the faster convenience foods they're already able to access in their communities. So all that to say, these are the 11 sites that we were able to start this past year, 9 of which was through the Tarrant County Public Health Grant. And as Ann mentioned, we didn't want just the one passionate person. We really wanted it to be a community effort, something that community owned and was excited about and understood and wanted to sustain themselves, especially with me being the one food bank employee and her being the public health employee. That's not a lot of people to try to run 11 gardens. That would be completely impossible and not sustainable. And so the way that we addressed it was making sure that any site that we worked with had at least 20 interested people from the community itself wanting to be involved, and that 3 to 5 of them wanted to be leaders, so that it wasn't one person, it was a group effort, even on the leadership level. And then we bring them together. I host a leadership training 3 times a year with sites that are interested, and they brainstorm and workshop together about the assets in their community, looking at mapping some partnerships in their community where there can be reciprocity, like schools or banks or a church with property. Maybe they're a food pantry and they're covered or surrounded by concrete. So maybe they can partner with a church in their area to use their property. Just getting them to think about, where are my resources? Where can I find resources? Who in my community can I ask to be involved in this effort? And that's going to make it more sustainable too. Once the grant funding runs out for that initial install, where are they going to get resources to sustain it? That's the important things that we want them to have in mind when they even start thinking about doing this as a project. Other things we talk about really are celebrating and making it about fun and making it about education and learning. This isn't just about, I need to grow food because I'm hungry. That's not what we want people to feel like. And no one wants to feel like a project. You know, you don't want someone coming to you and saying, you need help, so I'm going to help you. You want them to feel like it's their own and they own it. And so training leaders to convey that to their community by just involving them in the ways that they already are working. So we teach them how to go back and engage their communities. When they have meetings, have their community design the garden. Have their community contribute what fruits and vegetables they like to eat, or talk about the fact that they never eat fruits and vegetables and they don't really know how to cook them or how they even taste. You know, getting to those levels of what the community needs with the community leaders doing that themselves. So this is just a picture that I have of, it's a Bhutanese garden that we've done in Southeast Fort Worth, and just showing the power of the actual community that is going to be gardening in the garden, building the garden. That's a huge piece of it. If you can get involved, if you can get the community itself involved in every piece of the process, they're going to own it much more than if you build it for them and put the plants in and say, here's your garden. So that's a huge piece of what we try to do at the food bank, is help them design and implement the garden. And public health has been so kind to purchase a lot of the materials, but then have building days where we instruct them how to make 5 to 7 beds, starting small, but then give them resources and ideas about how they can expand for very low cost. This is one that we actually just put in at I don't know if you can see it, at a senior center over in Southeast Fort Worth, Eastwood Terrace. They were very excited. Another one on the north side of Fort Worth. So this grant was for cinder block raised beds, which I was pretty shocked that they produced the amount that they did with the drought this summer. That's not the most encouraging time to start your first gardening project, is right before a drought, because most of them planted in April right before it got hot. But they produced, we didn't start doing monthly reporting until July, but I was getting just email reports from some of these gardens, this one in particular, saying that they donated, in their first 3 months, they donated over 400 pounds just to the food pantry that they're partnering with. And they just donate their excess. We don't make them give a certain percentage. We just say, one of the values that we talk about in the leadership training is, if you have enough to satisfy your needs, give it to someone that you know needs it. You know, instead of letting it go to waste, be mindful of resources and how you can really improve your community by just giving to your neighbor what you don't need. So that's been pretty exciting. And this is the Bhutanese Garden that just got planted this fall. There's actually 30 families involved with this garden, and they have a huge communal bed. One thing that a lot of these sites are looking at is community gardens can sometimes get a lot of flack for wasting space because they're all in little boxes, and the little boxes are great because they create individual empowerment, and they create a space that's someone's to own and someone's to take care of, and that can be a really important thing if you live in an apartment or if you don't feel like you have something that's your own. But going to more of this model where it's a combined almost farming model and raised bed model, it really can get more of a yield. So if you're looking at actually putting this food into food pantries, you can get a lot more of a yield by almost doing a hybrid. This is another one down in Como that's doing that hybrid model. They have 2 city lots that they've just totally planted with produce, and they give it to a local pantry, and they harvest twice a week off of that. And about 40 people in that community regularly go there to get fresh vegetables, and it really is just one tiny little aid agency in that neighborhood that's decided this is really important and made it an effort. And I think that really speaks to what communities can do if they get excited about an idea. And it's something that has been sustained for 4 years already and continues to grow as we're able to go out and do education and bring more people in. But it's something that requires very little money, but really does require people. And so it's once again focusing on the people, reintroducing people to being connected with their food, demystifying nutrition, which for a lot of people, they either don't have access to that knowledge or it's just confusing to them and they don't know how to put it into everyday life. And then bringing back cooking. It's becoming a lost art too. That's a Forest Hill library. They have some raised beds and this huge field they planted with beans, which they got a lot of. This is in August that it was looking like that. I was pretty excited. This is just an example of one of the gardens that wanted to expand, and we had already used the grant money, but we used wine bottles and created a little raised bed garden. Their soil's virtually rock, so we couldn't plant in it, but we created a little raised bed out of wine bottles, and stuff has been growing like crazy. This is one of the education programs I did in Como, and I thought this was an important point with the kids. We taught them how to garden and built beds, but we also did nutrition education through tastings. And I was amazed at these kids hadn't tried fresh tomatoes. They didn't know that tomatoes went into tomato sauce or salsa. They had never tried broccoli or celery or a lot of the really basic vegetables that you would think most people had tried. And so they were clearly super excited. We picked these out of the garden. They were growing there, and they really enjoyed them. And they would ask me to bring them tomatoes and sunflower seeds every time they saw me. But one thing I did think was interesting, we were tasting berries one day, and the kids were like, "Oh, these are so sour. Why aren't they sweet?" And we got into this discussion about sugar, and I was like, "Well, what makes food sweet?" And they knew it was sugar. And I was like, "Well, raise your hand if your parent or your guardian has diabetes." And they all raised their hand. There was about 15 of them there. And I said, "Well, do you know what diabetes is?" And they could talk about insulin. They talked about pumps and shots. They talked about how it's sugar in your blood. And so I just said, "Do you know how sugar gets in your blood?" And they had no idea. So it was just this, they knew a lot about the disease state, but they had this disconnect with why it was there. And so that was that was our second class. And the rest of the time, one of the volunteers brought Oreos, and all the kids were like, "Oh, you're trying to give us diabetes," and so they wouldn't eat them. So that was maybe making them paranoid, but it just, to me, that was a really simple, powerful example of what a little bit of education does. It doesn't take a lot of education sometimes. It doesn't take complicated words. You know, I think that's where the gap is often. We're using these big, huge words that don't translate to little kids, you know, so they don't make connections like that. And just taking time to help those kids learn how to make healthy snacks, even if it's not cooking, or learn what vegetables taste like. That's a big deal, I think. And it's not very measurable, but it will have impact. These are just them working together to build a garden bed. They're learning about amending soil, and we did some science lessons with microbes and building soil health and what plants need and how that plugs into your body to make it work. And it was a really powerful class. The kids were asking to have sleepovers in the garden after it was done. We met for a few months, and they just really enjoyed it. And I've seen that again and again in communities, especially with kids, but with adults too. It just really is something that if you can find a way to engage them, it's something that winds up being impactful and that they enjoy doing, and that really will benefit their health. I was just talking to one man, and he ran up to me. He's been gardening since April, and he goes, "Katey, I just went to my doctor, and he's been my doctor for 20 years, and I've been on this high blood pressure medication, and he is obese, and he was like, my doctor's been on me to lose weight for years and years, and I've lost 50 pounds since April. And my doctor said, I don't know what you're doing, but keep doing it. He was like, I'm gardening, and he was excited, and I'm eating the stuff that comes out of it, and I didn't eat produce before. And again, just another story about what it does for individuals. This was a composting class in Forest Hill. Seed starting class in Como. We've started doing, to try to build even more sustainability and collaboration, doing quarterly community garden leaders meetings. Where just the leaders from all the community gardens and really anyone else associated with the garden can come and share ideas, share what's frustrating to them, and troubleshoot together. And then we also do some education. So this was them all learning how to start seeds before the fall so they could go back to their sites and teach it. And then just one brief note to another initiative we have through the food bank. I've heard a lot, well, do people even want fresh food? Is this even something that's worth putting a lot of time into, because there's a really slow return? But we have this program called the Mobile Pantry Program, and this is what this is a picture of. We have 6 in Tarrant County, and this is basically a traveling food pantry that's predominantly dairies, yogurts, fruits and vegetables, and sometimes breads. And we just started one in Stop 6, actually. Yeah, we have some pictures. Our first one at Stop 6 was just recently. I think it was September 28th. And our capacity is 550 people, and we had, or 550 families, and we had, I think, 587 families show up. It was almost 1,500 people that were there. And they just cleaned us out. It was almost all produce, and they were really excited about it. It was produce and yogurt and bread. And that's just, I think, a testimony to, A, the response to fruits and vegetables. People want them. And B, it does indicate the need in this community for some fresh food sources. And, I mean, we have those 5 other pantries. It took us months to get up to 200 numbers. The fact that that was the first showing of that, it's over at Mayfield Baptist Church, really was impressive, and I think worth noting. But if you want to get involved, volunteering at the food bank is always good, donating time or money or whatever you want to donate. But that's all I have.
I'm a professor at the Texas Prevention Institute at the UNT Health Science Center, and we've been working on a program called Healthy Harvest that was funded by the Trammell Crow Foundation. And I'm going to tell you a little bit about the project, but first give you just a little background. I know we've talked a lot about this, but just to remind you, we know that chronic disease is the #1 cause of death. So 7 out of 10 deaths are caused by a chronic illness. And the more that we spend, the sicker Americans become. So increasing burden of disease, diabetes, heart disease, hypertension, asthma, and depression account for more than 70% of deaths. So what kills the human body? Causes of death. We've got heart disease, cancer, stroke. But what causes these things? What lifestyle behaviors? As we would expect, tobacco, #1, diet and physical activity patterns, #2. So that's why we're working on these issues around obesity prevention, treatment, increasing physical activity, and healthy diets, because it's one of the leading causes of death in our country. And as we talked about earlier, there's health disparities, meaning specific population groups suffer at a higher rate from these chronic illnesses than others. There's a ton of confounds, as she talked about, income, environment, what we call a toxic environment, lack of grocery stores, that lead to these health disparities. It's not just one cause. Okay, so we take the angle of obesity prevention around community gardens, and community gardens for us is just one step in the process of improving the access to food in certain areas. But we know consequences of obesity tied to a ton of health problems. What causes obesity? Diet and physical activity. So diet and physical activity is linked to so many different things. Genetics and environment. A recent U.S. Census report, they picked the 5 things that cause the city to be the most unhealthy, and lack of access to a grocery store was one of the top 5. I was really surprised that it made it into the top 5 of what makes a city one of the most unhealthy cities in our United States. Okay, so these are some pictures of South Dallas. I'm sure there's some areas in Fort Worth that look similar, but you can get an idea of why maybe these environments aren't so conducive to healthy behaviors. And this is a map of grocery stores in the Dallas area. Has anyone seen this map before? Okay. I've got one of Fort Worth, too, that you'll see at the end. It'll keep you guys in suspense. Okay, so this is Dallas. This is the South Dallas area down here. This is the more affluent North Dallas area. Every circle is a mile. And the green means more grocery stores. The red means no grocery stores. So you can see in North Dallas, there's a ton of grocery stores. West, South Dallas, we've got some grocery stores in these areas, but there's still some pockets. And one of these circles is a mile. So this is a big, giant region right here where there are no grocery stores. And a lot of these people are dependent on public transportation. So you can already see the disconnect between going to your doctor and them telling you to eat more fruits and vegetables, to eat healthy. But then you come back home to here, and there's no place to get them. And you saw the previous pictures, there's no place to be physically active in these areas as well that's safe. All right, so this sets up the picture of why Trammell Crow gave us the money to put some gardens in this area. So Healthy Harvest has just been in existence for about a year and a half. We've got gardens in 5 churches and 1 private school. I'm going to show you the data for 4 churches and 1 private school because one of our churches just didn't do so well, and that happens. And we can talk a little bit about that later if you feel the desire to know. But our goal is to develop sustainable models to improve access to fruits and vegetables and to actually measure what's going on. We can assume that installing community gardens is going to improve access to fruits and vegetables. We don't actually know that. There's very little scientific data showing that when you put in a garden, people eat more fruits and vegetables. Qualitatively, people report that they do. But to my knowledge, no one has actually measured it in the gold standard scientific way of fruits and vegetables. We haven't either yet, but we are trying. And this is our pilot data to go in and get larger grant dollars to actually measure and find out what's going on in these gardens, what's the radius of impact, and how can we bolster these attempts through other community-supported agricultural programs. Okay. This is the model that we use. This is kind of the evolution of Healthy Harvest. So the whole point is to improve obesity and related diseases through improving physical activity and dietary behaviors. And these 3 circles all lead to that. So our mediating institutions are things like churches, schools, business, government. We do a really good job with churches and schools and CBOs, community-based organizations. We have had less luck with business and government in terms of connecting all of the pieces of the puzzle. Medicine, these are the people that understand disease and how to treat disease. They don't necessarily know how to do it in the community. That's where public health comes in, people like Katey and Ann. So they're working in these sectors to develop community programs and education. So the Healthy Harvest came out of working with the community, so actually engaging the community and finding out what they want, what are their interests, what are their concerns, and how can we address them. Not developing a program at UNT HSC and taking it to the community. You've got to start with the community members, or there's not any buy-in. Okay, and this model right here that we've been working on, and Dr. DeHaven, my mentor at UNT, has been working on, has resulted in nearly $40 million worth of grant funding through the NIH, the CDC, and philanthropy. So we hope to continue that. Okay, so I'm going to go through our gardens really quick. So this is Golden Gate before we started it. Golden Gate is, they have a jail recidivism program that uses the garden. It has not been one of our more successful gardens because the people are transient. And we find that if people are at the site continuously, the gardens do better. But they even, and so this was after. That's what the garden looked like after it was built. And we measure bi-monthly. We go out and do measurements of these gardens to find out what is going on. Are they in use? We have a 2-page form that we fill out. And we also ask them to weigh their produce, which doesn't always happen, but we try. So you can see first quarter, they had about 20% of their beds were in use and growing produce. And by the fourth quarter, they were close to 80%. And we did do some trainings in between these. Okay, First CME, which is in South Dallas. All of these churches are in South Dallas. This is their garden. They're doing a great job. They got about 250 pounds of weighed produce over the year. We like to measure how many volunteers come out because it's an indication of community engagement. And, you know, all of these churches, we've done focus groups with about 50 people to try to figure out what are barriers and what are the things that improve their garden, what makes their garden work. And one of the things we're finding is that there's different models. Some churches have a garden management model, which is kind of what Katey was talking about, where 3 to 5 people kind of take on the role and they do the garden for everybody at the church. And then other churches have a full church model where the whole garden is harvested and maintained by everybody. There's not individual specific beds. One giant bed would be all tomatoes. One giant bed is all peppers, and it's the responsibility of everybody. And both models are working well. Distribution systems is the biggest issue right now. Is figuring out how they can sell their produce and connect with other farmers markets or create farmers markets in low-income areas and get past zoning issues and some of the business issues that come into play when you start selling things. Okay, so Christian Stronghold, this is one of our star gardens, and it's run by a group of about 3 people, and they're doing a great job. Almost 1,000 pounds of produce in 1 year. They recorded 112 volunteers. I know for a fact more than that showed up out there because I've seen more than 112 people out there, but recording is always an issue. Highland Hills, this is the one that's kind of a full church model. They're also doing great, about 180 pounds of produce. And these are just some pictures of the produce that we've gotten out of these gardens. Giant watermelon, tomatoes. It really is amazing. St. Philip's, this is a different model. A lot of school gardens are science projects, and that's great, but they aren't actually getting food from the garden into families' hands. So with St. Philip's, we've been working really hard to figure out, once they get their garden successful in terms of who's going to do the maintenance and the harvesting. It's just challenging when you're working with children that don't actually live in that neighborhood. They've had their lawn person, their maintenance person has kind of taken over, and that's starting to work. But they have a lot of great ideas in terms of having the Boys and Girls Clubs sell produce in little pre-packed containers and figuring out ways to sustain their garden through selling these fruits and vegetables. Just some pictures of the kids. And they're doing all right over there at St. Philip's. That is a different model, and we've had some stumbling blocks trying to figure out how to make this work in a school community partnership. But they're definitely on board. Another extension of Healthy Harvest is a senior living center called Carpenter's Point over in South Dallas, and it has a garden built into the property, and that's also one of my own passions, is trying to get some of these gardens into senior living centers because the quality of the food is not so great, and they tend to all have diabetes and other chronic diseases, and they're depressed. So it seems like a nice captive audience for community gardening. I force them to garden. Joking. Okay, so this is a picture of Fort Worth. So we just did this map a couple weeks ago, actually. And I don't know if you know this, but in Fort Worth, we have a food policy council that is going to be having our first meeting next week. And I think this map was made in preparation for that. But you can see it kind of mimics Dallas, and that you've got this southeast region that is really lacking in grocery stores. And we can send out copies of this to anyone who would like it. The bottom line is do we think community gardens alone are going to solve all of our food insufficiency issues and obesity? Absolutely not. It needs to be tied in with education and other programs, but it's one step in a broader vision of community-supported agriculture in these regions, along with education, philanthropy, and grants. Another, I think, big component of this is trying to utilize the resources that already exist. So instead of us getting grants to bring in programming, when the grant goes, the program goes. The idea is to get grants to develop programs with the community, find out what resources are already there, use them, use the grant to measure it to make sure it's actually working, and then to start to disseminate that to other communities that have a similar structure. But for us, the goal is that when the money goes away, the program continues. And that's it.